হ্যালো মাই ডিয়ার ফ্রেন্ডস, ওয়েলকাম টু নার্সেস ভয়েস চ্যানেল। আজ আমরা আবার একটি প্রিভিয়াস ইয়ার কোয়েশ্চেন পেপার দেখে নেব। এখন অলরেডি ইএসআইসি স্টাফ নার্স এন্ট্রান্স এক্সামের নোটিফিকেশান বেরিয়ে গেছে। সেই জন্য বন্ধুরা এখন প্রচুর পরিমাণে প্র্যাকটিস করে যেতে হবে, প্রিভিয়াস ইয়ার কোয়েশ্চেন পেপার দেখতে হবে, যাতে করে কোয়েশ্চেনের প্যাটার্ন বুঝতে অসুবিধা না হয়। তো চলো বন্ধুরা, দেরি না করে আমরা আজ আবার একটি ইম্পর্টেন্ট কোয়েশ্চেন পেপার প্র্যাকটিস করে নিই। For this question paper, total marks is 80 and duration 90 minutes. বন্ধুরা, ভিডিও শেষে অবশ্যই কমেন্ট করে জানিও কে কতগুলি কোয়েশ্চেনের অ্যান্সার করতে পেরেছো, এবং চ্যানেলটি সাবস্ক্রাইব করে পরস্পর ভিডিওগুলি দেখতে থাকো। তো বন্ধুরা, আজ আমাদের ফার্স্ট কোয়েশ্চেন হলো দ্য হায়ারার্কি অফ হিউম্যান নিডস হোয়ার নার্সেস প্রায়োরিটাইজ বেসিক ফিজিওলজিক্যাল নিড ইজ আইডেন্টিফাইড বাই সিগমন্ড ফ্রয়েড, কাবলার-রস, এরিক এরিকসন, or option D, Abraham Maslow. And here the right answer is option D, Abraham Maslow. Question number 2. The most reliable index of the cerebral status is pupillary response, response to pain, level of consciousness, and deep ganglion reflex. And here the right answer is option C, level of consciousness. Question number 3. Which one of the following is a water soluble vitamin? Vitamin A, vitamin C, vitamin D, or vitamin K? And here the right answer is option B, vitamin C. Vitamin C is the water soluble vitamin and others are fat soluble vitamin. Next, question number 4. You have a stock solution of 20%. To prepare 1 liter of 5% solution, how much diluent will be added? Option A 100 ml, option B 150 ml, option C 200 ml, or option D 250 ml. এখানে আমরা একটা ফর্মুলা ইউজ করব, D by H into Q is equal to A, যেখানে D মানে হলো ডিজায়ার ভলিউম, H মানে হলো ইন হ্যান্ড মানে আমার হাতে কত আছে, Q ইজ ইকাল টু কোয়ান্টিটি মানে কত ml এর মধ্যে ওটা প্রেজেন্ট আছে, অ্যান্ড A মানে হচ্ছে অ্যামাউন্ট মানে আমি কত অ্যামাউন্ট ইউজ করব। যেখানে D হচ্ছে 5%, কারণ আমাকে 5% সলিউশন বানাতে হবে। H মানে হচ্ছে ইন হ্যান্ড, আমার হাতে আছে 20%, তাহলে H ইজ ইকাল টু 20, অ্যান্ড কোয়ান্টিটি কতর মধ্যে আমাকে এটা বানাতে হচ্ছে, আমাকে 5% বানাতে হবে 1 লিটার জলের মধ্যে। সো এটাকে ক্যালকুলেশন করলে হচ্ছে 250 ml. সো হেয়ার দ্য রাইট অ্যান্সার ইজ অপশন ডি, 250 ml. কোয়েশ্চেন নাম্বার 5. দ্য অ্যান্টিডট টু হেপারিন ইজ ক্যালসিয়াম গ্লুকোনেট, vitamin K, procamin sulfate, or option D, atropine. And here the right answer is option C, procamin sulfate. Question number 6. For a comatose patient, the highest priority nursing diagnosis is altered sensorium, ineffective airway clearance, option C, impaired physical mobility, or option D, altered nutrition. And here the right answer is option B, ineffective airway clearance. Question number 7. In a patient with decorated posturing, the nurse observes flexion of elbows, extension of knees, and plantar flexion of feet, flexion of upper and lower extremities, extension of upper and lower extremities, or option D, extension of elbows and knees and flexion of wrist. And here the right answer is option A, flexion of elbows, extension of knees, and plantar flexion of feet. Question number 8. The normal central venous pressure CVP reading is between 0 to 5 cm, 5 to 10 cm, 10 to 15 cm, or option D, 15 to 20 cm. And here the right answer is option B, 5 to 10 cm. A patient with congestive cardiac failure experiences dyspnea due to accumulation of fluid in the interstitial spaces and alveoli of lungs, bronchial secretion and spasm, pulmonary embolism, and option D, pulmonary congestion resulting from cardiomegaly. So here the right answer is option A, accumulation of fluid in the interstitial spaces and alveoli of lungs. Question number 10. A client on anticoagulant therapy is specifically monitored for nausea, chest pain, insomnia, or option D, hematuria. And here the right answer is option D, hematuria. In case of anticoagulant therapy, there have chance of bleeding, and hematuria means blood in urine. So there have chance of hematuria. Question number 11. The nurse who observes projectile vomiting in a newborn suspects tracheoesophageal fistula, heart-sprung disease, congenital hypertrophic pyloric stenosis, or option D, congenital heart disease. And here the right answer is option C, congenital hypertrophic pyloric stenosis. Question number 12. A person with diabetes mellitus is asking you the calories obtained from 1 teaspoon of sugar. Your answer would be 5, 15, 20 or 60. And here the right answer is option C, 20 calories. Question number 13. Which of the following food items are rich sources of vitamin A? Green leafy vegetables and yellow fruits. Option B, rice and potatoes. Option C, green gram and dal. And option D, milk and milk product. And here the right answer is option A, green leafy vegetables and yellow fruits. Question number 14. The urinary output of a client for 24 hours was 350 ml. The nurse was documenting the observation as, and here the options are anuria, option B polyuria, option C dysuria, or option D oliguria. And here the right answer is option D oliguria. Oliguria is defined as urinary output less than 400 ml per day or less than 20 ml per hour. Question number 15. Which one of the following term indicates the increase in the size of cells without increase in the number of cells? Hyperplasia, hypertrophy, dysplasia, or atrophy? And here the right answer is option B, hypertrophy. Question number 16. When the client can breathe only in upright position, it is termed as orthopnea, dyspnea, tachypnea, or apnea. And here the right answer is option A, orthopnea. Question number 17. A client with hypoventilation is prone to develop metabolic acidosis, respiratory acidosis, respiratory alkalosis, or option D, metabolic alkalosis. And here the right answer is option B, respiratory acidosis. Question number 18. A client after pneumonectomy will be positioned on supine position only, supine and either sides, operatic side or back, or unoperatic side or back. And here the right answer is option C, operatic side or back. Question number 19. When periods of hyperapnea alternates with period of apnea, the breathing pattern is termed Kussmaul's respiration, chain-stroke respiration, bradypnea, or tachypnea. And here the right answer is option B, chain-stroke respiration. Question number 20. A client who is sent home with an ileostomy requires dietary supplementation with fiber, sodium, potassium, or option D, vitamin B12. And here the right answer is option C, potassium. An ileostomy causes low potassium level due to electrolyte imbalance. So potassium supplementation is needed. Question number 21. A client after liver biopsy should be vigilantly observed for hemorrhage, dyspnea, vomiting, or pain. And here the right answer is option A, hemorrhage. Question number 22. The rationale for using normal saline to start blood transfusion is normal saline is commonly used as a primary IV solution. It is compatible with blood. Normal saline prevents hemolysis, or option D, dextrose deactivates blood. And here the right answer is option C, normal saline prevents hemolysis. So the using normal saline before starting the blood transfusion is needed. Question number 23. In case of blood transfusion reaction, the first nursing intervention would be notify the physician, stop transfusion, slow down the transfusion, and option D, administer antihistamine. And here the right answer is option B, stop transfusion. Question number 24. The priority nursing assessment in an immediate post-anesthesia client is to monitor vital sign, check gag reflex, assess pain, or option D, assess airway vacancy. And here the right answer is option D, assess airway vacancy. Question number 25. Alkylating chemotherapeutic agents used in cancer treatment acts by damaging DNA in the cell nucleus, destroying messenger RNA, creating a hormonal imbalance, and option D, interrupting cellular metabolism. And here the right answer is option A, damaging DNA in the cell nucleus. Question number 26. The most informative measurement for determining cardiogenic shock is cardiac output, arterial blood pressure, oxygen saturation, or option D, central venous pressure. And here the right answer is option A, cardiac output. Question number 27. One of the important signs that nurse would observe in hypovolemic shock is hypertension, tachypnea, oliguria, or option D, cyanosis. And here the right answer is option C, oliguria. Question number 28. The normal pH of blood is less than 7, 7 to 7.35, 7.35 to 7.45, or option D, less than 7.45. And here the right answer is option C, 7.35 to 7.45. Question number 29. Normal serum potassium level is 2.3 to 3.5 milliequivalent per liter, 3.5 to 5.3 milliequivalent per liter, 5.32 to 5.5 milliequivalent per liter, or option D, 7.5 to 8.9 milliequivalent per liter. And here the right answer is option B, 3.5 to 5.3 milliequivalent per liter. Question number 30. Normal serum creatinine level is 0.5 to 1.5 mg per gl, option B, 1.5 to 3 mg per gl, option C, 3 to 5 mg per gl, or option D, 5 to 8 mg per gl. And here the right answer is option A, 0.5 to 1.5 mg per gl. Option A, 95 ml per minute, option B, 110 ml per minute, option C, 125 ml per minute, or option D, 150 ml per minute. And here the right answer is option C, 125 ml per minute. Question number 32. Normal serum albumin is 1.5 to 3 mg per 100 ml, option B, 3.5 to 5 mg per 100 ml, option C, 5 to 7.5 mg per 100 ml, and option D, 7 to 10 mg per 100 ml. And here the right answer is option B, 3.5 to 5 mg per 100 ml. Question number 33. A vaginal examination is indicated when membranes rupture spontaneously in a pregnant woman with polyhydramnios to assess fetal maturity, determine stage of labor, note the position of the fetus, and option D, rule out cord prolapse. And here the right answer is option D, rule out cord prolapse. Question number 34. Which one of the following is a major cause for atonic postpartum hemorrhage? Infection, recurring products, systemic lupus erythematosus, and option D, jaundice. And here the right answer is option B, recurring products. Recurring products is the major cause for atonic PPH. Question number 35. Normal respiratory rate in a newborn is less than 20 per minute, option B, 20 to 40 breaths per minute, option C, 40 to 60 breaths per minute, and option D, more than 60 breaths per minute. And here the right answer is option C, 40 to 60 breaths per minute. Question number 36. The most accurate area to check the pulse rate in an infant is carotid artery, brachial artery, temporal artery, or option D, apex of the heart. And here the right answer is option D, apex of the heart, using the stethoscope. Question number 37. A staff nurse who was called by the nursing superintendent for a feedback on poor performance, spending the remaining time of the shift blaming her supervisor and colleagues. The mental mechanism used by her is projection, reaction formation, rationalization, or option D, compensation. And this is the projection defense mechanism. So here the option A is the right answer. Question number 38. Which one of the following drug is a mood stabilizer? Librium, lithium carbonate, tofranil, or option D, haloperidol? And here the right answer is option B, lithium carbonate. Question number 39. In the ECG recording of a client, the nurse observed tall peak T waves, flat P waves, wide QRS complex, and prolonged PR interval. The nurse identifies hypokalemia, hyperkalemia, hypocalcemia, or option D, hypercalcemia. And here the right answer is option B, hyperkalemia. In case of hyperkalemia, the tall peak T waves, flat P waves, and wide QRS complex with prolonged PR interval. Question number 40. The physician was prescribed 20 milliequivalent of KCl to a client. The available KCl is 10 milliequivalent per 5 ml. The nurse will administer 5 ml, 7.5 ml, 10 ml, or 10.5 ml. And here we use the same formula D by H into Q is equal to A. And here D means desired volume is equal to 20. H means in hand 10 and quantity means 5 ml আমার 10 ml equivalent আছে and amount এখানে আমরা calculate করলে পাবো 10 ml. So here the option C 10 ml is the right answer. Question number 41. Which one of the following indicates increasing intracranial pressure following head injury? Option A, restlessness. Option B, decreased pulse rate. Option C, increasing blood pressure. And option D, widening pulse pressure. And here the right answer is option A, restlessness. Question number 42. Which one of the following condition is a common cause of cardiogenic shock? Electrolyte imbalance, fluid overload, left ventricular failure, or option D, hypovolemia. And here the right answer is option C, left ventricular failure. Question number 43. Which one of the following is the drug of choice in ventricular arrhythmias? Ingerol, digoxin, sorbitrate, or option D, lidocaine. And here the right answer is option D, lidocaine. Lidocaine is the drug of choice in ventricular arrhythmias. Cyanotic spell is a features of TOF, VST, PTA, or AST. And here the right answer is option A, TOF, tetralogy of Fallot. Question number 45. The infant experiencing hypercyanotic spell is placed in high Fowler position, knee chest position, prone position, or option D, supine position. And here the right answer is option B, knee chest position. Question number 46. When a hemophilic carrier female marries a normal male, then the chance of their daughter becoming a carrier is 100%, 75%, 50%, or 25%. And here the right answer is option C, 50%. Question number 47. A nurse observes Koplik spot on oral examination of a child with fever. This is indicative of measles, diphtheria, dengue, fever, or whooping cough. And here the right answer is option A, measles. Question number 48. Census is taken once in every 5 years, 10 years, 15 years, or 20 years. And here the right answer is option B, 10 years. Census is taken once in every 10 years. Question number 49. The nurse is teaching a client about iron-rich food to be consumed to correct anemia. Which one of the following vitamins has to be supplemented to increase iron absorption? Vitamin C, vitamin D, vitamin B6, and option D, folic acid. And here the right answer is option A, vitamin C. Question number 50. In which of the following leadership style the leader values the individual characteristics and abilities of each subordinate? Autocratic, democratic, laissez-faire, or option D, bureaucratic. And here the right answer is option B, democratic. Question number 51. Which one of the following is known as the pacemaker of the heart? SA node, AV node, bundle of his, or option D, Purkinje fiber? And here the right answer is option A, SA node. Question number 52. The left atrium and the lateral and posterior surface of the left ventricle is supplied by the left anterior descending coronary artery, the left coronary artery, the right coronary artery, and option D, the circumflex artery. And here the right answer is option B, the left coronary artery. Question number 53. Which one of the following is a potassium sparing diuretics? Spironolactone, mannitol, furosemide, or option D, chlorothiazide? And here the right answer is option A, spironolactone. Tablet digoxin is withheld if the pulse rate is less than 40 beats per minute, 50 beats per minute, 60 beats per minute, or option D, 70 beats per minute. And here the right answer is option C, 60 beats per minute. Question number 55. A nurse who observed absence of P waves and fibrillating waves before each QRS complex on the cardiac monitor will interpret the client's cardiac rhythm as sinus tachycardia, ventricular fibrillation, ventricular tachycardia, and option D, atrial fibrillation. And here the right answer is option D, atrial fibrillation. Question number 56. The most important risk of deep vein thrombosis (DVT) is myocardial infarction, pulmonary embolism, phlebitis, or option D, bleeding. The most important risk of deep vein thrombosis is pulmonary embolism. Question number 57. Which one of the following intervention should be avoided by the nurse while caring a client with deep vein thrombosis? Providing bed rest, elevation of affected extremities, massaging the extremities, or option D, administering analgesic? And here the right answer is option C, massaging the extremities. Extremities massage in patient with deep vein thrombosis can dislodge the thrombi, leading to life-threatening pulmonary embolism. Therefore, it should be contraindicated. Question number 58. The normal volume of cerebrospinal fluid is 25 to 50 ml, 50 to 100 ml, 125 to 150 ml, or option D, 150 to 200 ml. And here the right answer is option C, 125 to 150 ml. Question number 59. Which of the following neurotransmitter is deficient in myasthenia gravis? Acetylcholine, dopamine, serotonin, or norepinephrine? And here the right answer is option A, acetylcholine. Question number 60. In paraplegia, paralysis involves all four extremities, only lower extremities, one side of the body, and option D, only upper extremities. And here the right answer is option B, only lower extremities. Question number 61. In the assessment of a client with Guillain-Barré syndrome, the nurse gives high priority to pain, level of consciousness, motor function, or option D, respiratory status. And here the right answer is option D, respiratory status. Question number 62. Which one of the following is an anticonvulsant drug? Bromocriptine, largactil, phenytoin, or chlorodiazepoxide? And here the right answer is option C, phenytoin. Question number 63. Perception in the absence of external stimuli is termed as delusion, illusion, phobia, or hallucination. And here the right answer is option D, hallucination. Question number 64. 1 tablespoon is equal to 5 ml, 10 ml, 15 ml, or 30 ml. 1 tablespoon is equal to 15 ml. So option C is the right answer. Question number 65. The physician prescribed 1500 ml ringer lactate to be infused in 12 hours. 1 ml is equal to 15 drops. The drop rate would be, এখানে আমরা ড্রপ ক্যালকুলেশনের ফর্মুলা ইউজ করব। টোটাল ফ্লুইড ইন্টু ড্রপ ফ্যাক্টর ডিভাইডেড বাই টোটাল আওয়ার ইন্টু 60। সো এখানে টোটাল ফ্লুইড ভলিউম 1500 ml ইন্টু ড্রপ ফ্যাক্টর বলে দিয়েছে 15। নেক্সট টোটাল আওয়ার হচ্ছে 12 আওয়ার্স ইন্টু 60। এটাকে ক্যালকুলেশন করলে হয় 31.25। সো হেয়ার দ্য রাইট অ্যান্সার ইজ অপশন সি। Question number 66. The physician prescribed phenytoin 0.2 gram orally twice daily. The medicine is available as 100 mg capsule. How many capsules will be administered for a dose? এখানে আমরা দেখতে পাচ্ছি 0.2 গ্রাম ওরালি আমাকে ফেনিকোইন দিতে হবে টুয়াইস ডেইলি। তো 0.2 গ্রামকে আমরা প্রথমে মিলিগ্রামে কনভার্ট করে নেব, কারণ আমাদের কাছে মেডিসিন অ্যাভেলেবেল আছে 100 mg ক্যাপসুল। সো 0.2 গ্রামকে আমরা যদি এমজিতে কনভার্ট করি তাহলে সেখানে হচ্ছে আমাদের 200 mg। 200 mg মানে আমার যেহেতু একটা ক্যাপসুলে 100 mg আছে, তাহলে আমাকে এক্ষেত্রে দুটো ক্যাপসুল ইউজ করতে হবে। সো হিয়ার দ্য রাইট অ্যান্সার ইজ অপশন বি। Question number 67. During CPR of an adult client while performing the chest compression, the sternum will be depressed to half to 3/4 inch, 3/4 to 1 inch, half to 2 inch, or 2 to 2.5 inch. And here the right answer is option C, there to 2 inches. Here the options are half to 3/4 inch, 3/4 to 1 inch, 1.5 to 2 inches, and 2 to 2.5 inches. And here the right answer is option C, 1.5 to 2 inches. Question number 68. In which one of the following situations the rescuer uses the jaw thrust method to open airway? In all situations requiring CPR, if the client has a history of epilepsy, if the client has a history of head injury, and option D, if injury of the neck is suspected. And here the right answer is option D, if injury of the neck is suspected. Question number 69. Which of the following assessment data is relevant for a client diagnosed with glaucoma? History of Gavickis mellitus, history of migraine, history of chronic sinusitis, or option D, history of bronchial asthma. And here the right answer is option A, history of Gavickis mellitus. Question number 70. A nurse monitoring the intercostal drainage system of a patient with pneumothorax notes intermittent bubbling in the water seal chamber. The most appropriate action would be to inform the physician, check for airway leak, document the observation, and option D, clamp the chest drainage tube. And here the right answer is option C, document the observation. Question number 71. The arterial blood gas ABG report of a client shows a pH of 7.32, PCO2 52 mm of Hg, and PO2 85 mm of Hg, and HCO3 of 27 milliequivalent per liter. The nurse interprets that the client has respiratory acidosis, metabolic acidosis, respiratory alkalosis, or metabolic alkalosis. আমরা জানি নর্মাল রেঞ্জ অফ পিএইচ 7.35 to 7.45, bicarbonate or HCO3 22 to 26, base excess -2 to +2, and arterial partial pressure of carbon dioxide PaCO2 36 to 44, and oxygen 100%. যখন পিএইচ কম থাকবে এবং PCO2 নর্মালের থেকে বেশি থাকবে এবং এক্ষেত্রে HCO3 বেশি থাকতে পারে, তখন রেসপিরেটরি অ্যাসিডোসিস হবে। এবং পিএইচ যদি বেশি থাকে এবং PCO2 যদি কম থাকে এবং এই ক্ষেত্রে HCO3ও কম থাকবে, সেক্ষেত্রে রেসপিরেটরি অ্যালকালোসিস হবে। এবং পিএইচ, PCO2 এবং HCO3 যদি সবটাই যদি কম থাকে তাহলে সেই ক্ষেত্রে মেটাবলিক অ্যাসিডোসিস, এবং সবই যদি বেশি থাকে তাহলে সেক্ষেত্রে মেটাবলিক অ্যালকালোসিস হবে। আমাদের চ্যানেলে অলরেডি এই এবিজি অ্যানালাইসিসের উপরে একটি ডিটেলসে আলোচনা করা হয়েছে। যারা ভিডিওটি এখনও পর্যন্ত দেখোনি তারা অবশ্যই চ্যানেলে গিয়ে পুরো ভিডিওটি দেখে নিও। তাই এই ক্ষেত্রে আমাদের রাইট অ্যান্সার হবে অপশান এ, রেসপিরেটরি অ্যাসিডোসিস। Question number 72. While monitoring a child after tonsillectomy, the nurse observes his swallowing frequently. This indicates that the child is feeling thirsty, recovering from anesthesia, bleeding, or option D, having pain. And here the right answer is option C, bleeding. Question number 73. The nurse is reviewing the laboratory values of a patient scheduled for surgery. Which one of the following result is unfavorable? APS 84 mg/, hemoglobin 8 g/, serum creatinine 0.7 mg/gl, or blood urea 28 mg/gl. And here the right answer is option B, hemoglobin 8 g/, কারণ এক্ষেত্রে হিমোগ্লোবিন অনেক কম আছে। Next question, which one of the following statement is incorrect about Glasgow Coma scale? The scale measures the neurological status, the sensory responses are easily assessed, the maximum score is 15, a score less than 8 indicates coma. And here the right answer is option B, the sensory responses are easily assessed. Question number 75. The site selected by a nurse to administer an intramuscular injection to a 6-month infant is vastus lateralis, ventrogluteal, dorsogluteal, or option D, deltoid. And here the right answer is option A, vastus lateralis. Question number 76. Which of the following age group children engage in parallel play? Infant, toddler, preschooler, or schooler? And here the right answer is option B, toddler. Question number 77. In which one of the following condition Carning sign is considered as a positive indicator? Meningitis, hepatitis, deep vein thrombosis, or option D, typhoid? And here the right answer is option A, meningitis. Question number 78. Which of the following is the most potent stimulus for erythropoietin production? Anemia, proteinuria, hypoglycemia, or hypoxia? And here the right answer is option A, anemia. Question number 79. One of the major complications that occur during the hemodialysis is muscle cramp, hypotension, air embolism, or pulmonary edema. And here the right answer is option B, hypotension. Next question number 80. The left down reflex during breastfeeding is influenced by the hormone progesterone, estrogen, prolactin, or oxytocin. And here the right answer is option D, oxytocin.